Hey guys, just wanted to share a little information today about perinatal mood and anxiety disorders and some of the things that we know can be correlated or risk factors for these disorders. As many as 1 in 5 women, that's actually 20% of women today that we know of, go through a perinatal mood or anxiety disorder like depression or obsessive compulsive disorder, OCD, or other anxiety issues during their pregnancy or postpartum stages. And we are learning that there are lots of things that can actually contribute to this experience in a woman's life if she has been through some other experiences beforehand. So just want to bring a little bit of awareness to what some of these risk factors can include so that you too can be aware. And if you are a mom or have a mom in your life who is pregnant or has just had a baby, you can be informed as to whether maybe postpartum depression or anxiety is a consideration for her. So some of the risk factors include naturally a previous mental health history. If there's a history of depression or anxiety for you or in your family, or any other mood or anxiety disorder, mental health disorder, then you could potentially be at risk for a postpartum mental health disorder. If there is a history of trauma, especially any history of sexual trauma, or if there's a trauma during your birth experience, this too can lead to an onset of depression or anxiety after the baby's born. If there's any history of substance abuse for you or in your family, this is also a risk factor for mood or anxiety disorder. If there were mixed feelings about your pregnancy, if you weren't sure you wanted to have a child and then you got pregnant, if it was an unwanted or an unplanned pregnancy, this can actually lead to the onset of some anxiety or depression after the baby's born or even during the pregnancy. And one of the most common and vast risk factors is just a lack of social support. And this is actually one of the most fixable risk factors, is when a woman does not have enough support in place to help her through the transition, since it's so momentous becoming a mom. She really needs a lot of support in place to kind of be there and help her when she's feeling overwhelmed or when she doesn't know what to do or doesn't have someone to talk to. Not having an adequate support system is actually a really strongly correlated risk factor with postpartum depression and anxiety. So that's why I do what I do in my practice. I like to bring awareness to just the normal rate of occurrence of postpartum depression or anxiety or perinatal pregnancy depression and anxiety, and know that with the right supports and with the right awareness in place, these can actually be preventable conditions and the transition into motherhood can go a lot smoother. So if this is something that's concerning you, you think you may meet some of the risk factors for postpartum depression or anxiety, or you're feeling stress during your pregnancy, reach out to me for a little support, because you can definitely do things to mitigate these risks and to have a happy baby, healthy mama, and an overall happy transition into motherhood. So thanks for watching, and I look forward to talking to you again soon.